Good evening, everyone. This is Dr. Nikki Anthony, and welcome to segment 5 of our Little Leaders Career Exploration Series. We have a really special guest tonight, and I'm excited to have him. He is Dr. Loading, Tre Smith, a doctor of nurse anesthesia practice. And before meeting him, I had never heard of this, so I'm super excited to learn more along with you all. So I invite you just to grab some popcorn, grab all the little people that's next to you, call them, text them, tell them to tune in and join us so that they can learn what this particular doctor practices and what it looks like, what it entails. And maybe this is something for one of your children or children connected to you to consider for a future profession. So make sure you're tuning in. Before we get started, I like to share our mission statement. I always share the mission statement because I want people to see that we try to stay mission aligned. And if you ever see us going off track, send me an email. Let me know. My goal is to always keep this organization moving forward on behalf of little people and of families. All right. So the mission of Little Hands, Big Hearts Little People Service Organization is to develop little people into servant leaders who think beyond themselves for the greater good through explicit and intentional opportunities for character development, selfless service to others, and community based volunteering. And what that looks like is we really want to just develop the next generation of servant leaders, not just in the children, because our little people go back into families. Primary age children are connected to parents and older siblings and grandparents. So everything that we do is family friendly. So keep that in mind. And moving forward. And so that's a little bit about the organization. Let's jump into the purpose of this evening. The purpose of this series and this evening, this particular segment, is to expose our families to different career paths from a representational stance. So we try to put people in front of you that look like you, who maybe come from backgrounds that you come from, but who are experts in their field. So on that note, I'm going to share just a little bit. I shared just about all I know. Um, I didn't want to ask too many questions ahead of time because I want to learn like you all are learning, but I asked him to share just the width of the breadth of his experience as in the field of anesthesia. So he is a doctor, I say loading, soon to become doctor. He has matriculated through his studies, and he will be graduating very soon. So we wish him well with that. But Dr. Loading, Trayvon Smith, if you don't mind, go ahead and introduce yourself, and then we will jump into our questions.
Thank you, and thank you for having me. I'm happy to be able to speak with all of you guys and give you a little insight into the profession. As you said, my name is Trayvon Smith. I'm sure at some point we'll go through all these letters and explain what they mean. But I am currently a registered nurse who is in a doctoral program to pursue becoming a certified registered nurse anesthetist or a CRNA. And as she said, will earn my doctorate in nurse anesthesia practice. I graduated from nursing school back in 2020, which actually I took a little bit of a long way to get there. Took a couple of detours, ended up in the emergency department, and then transferred eventually to the intensive care unit, where I continued to kind of grow in my nursing practice, and then kind of stumbled across this field of anesthesia. A lot of people don't know what CRNAs are, as you said. So I'm happy that we are here and we're giving a little more knowledge to the community. A lot of people look at the head of the bed in the operating room and they just see this figure and they see anesthesiologists. And there's a couple different paths of anesthesia. So with the certified registered nurse anesthetist, you have to be a registered nurse first. You have your bachelor's in science, and then you complete a 3-year doctorate of nurse anesthesia practice. So currently I'm at the end of year 2, so I will graduate next year. In addition to being a nurse, being a SRNA, which is a student registered nurse anesthetist, I'm also a husband and a father of 2. I have a 10, almost 11-year-old son and a 1.5-year-old daughter, and then a wife of, we just passed 5 years of marriage. So we're all going through this journey together.
That's awesome. Thank you for sharing. And I think I want to switch the order. You talked about taking a different path. So a lot of people think that college is straight out of high school and you go through, keep going and whatnot. And you get those degrees, then you get money, all this different stuff. Can you share a little bit? I've seen a few videos where you talk about your journey. Do you mind sharing a little bit about your journey, how different it was, and maybe encourage someone who, a parent, even because we've had some parents that say, well, I think I'm too old, or I think I missed my opportunity. Do you mind sharing a little bit of your journey, and we'll start there and kind of move into our questions.
Yeah, absolutely. So I'm a 90s baby. I was born in 94. I graduated high school in 2012 and actually graduated from a performing arts high school. I was the first person in my family to go to college. My parents both worked in fast food. I have two older sisters. They didn't go to college. So music at the time just kind of seemed like an easy transition. So I originally went to school for music education and performance. Um, at the end of my junior year, my son was born. Like I say, he's about to turn 11 now, and I was always said I had like a quarter life crisis. I was so confused of what I really wanted to do. Like I wanted to teach, but like not in a public school setting. I loved music, but I also had a family to take care of. So I left school at the end of my junior year. I worked at a gas station as a manager. I worked at a bank, and I just knew I wanted to go back to school. I knew that for myself, for my son. Now I have a daughter now, but I just wanted to do all those things that I wanted to previously. I knew that me leaving school the first time wasn't the end of the road for me. So I took some time, and I thought really about what I had interest in. Music was always going to be there, and it's something that I still tried to enjoy. But there was always this interest in medicine that I had. But like I said, I didn't really have anyone as an example for me that I could do it. So I talked to a lot of people. I did a lot of research. I looked at almost every career of medicine besides anesthesia, actually, which is funny. And I realized that nursing actually was a field that, for me, probably opened up the most doors. I had all these credits, at like 90 credits. I was able to do a 2-year associates of nursing program through a community college, which I did. So I would be able to get into the field quickly. Then I knew that while working, I could finish my bachelor's and I could go anywhere from there. So I thought about med school, nurse practitioner. Again, later stumbled across CRNA. And yeah, but there were a lot of, like I said, detours. I started as a secretary, then a PCT, then a registered nurse. So I kind of climbed the ladder, and I had a lot of people through the journey in my corner, but the biggest person that you have to have is yourself, right? You have to know that you can do it. You have to, once I finished nursing school, because it was like I just had that one barrier of I need to graduate. I didn't finish the first time, but I'm going to finish this time. And once I graduated from nursing school, I felt like I could do anything. And then I just kept moving forward. And that's what people always ask me. And I was just keep moving forward. Whatever your goal is, every day try to take an intentional step towards that. So whether you have kids, or other responsibilities, family things going on, there's always something you can do to work towards your goal.
I love that. I love it. So, part of this organization's goals, one of the goals is post secondary transition. I love that you talked about community college, right? So, how we know it was a positive experience, but would you encourage people who are trying to figure it out? Like, is community college something you would encourage? I do encourage it, especially financially. I think it's a benefit financially. I also think class size may be better in a community college, but also like the personable attention, the personal attention that you would probably get from professors, from teachers, and whatnot. But what do you think about community college, and maybe someone who is looking at a field, a profession in medicine, starting at community college or not being afraid to go to community college?
you know there's so many stigmas about community colleges and all these things, and when I tell people, looking at me now, my current situation, I went to a community college and I'm still going to have my doctorate in a year, right? So there's nothing wrong at all with going to community college, because like you said, a lot of people don't realize how much cheaper the programs are. A lot of people worry about having not having a college experience, but the community college I went to actually had a pretty big campus, a lot of people still hanging out in the cafeteria and having that environment. And there's so many programs there that people aren't aware of that translate into a 4-year degree, and but you can do it in a way that you save a lot of money, and that there's more flexibility. So me, again, I worked full time, like I said, as a patient care tech to a nursing school, and I live in Pittsburgh. There's a million different nursing programs around here. We have so many hospital systems. There's hospital-based programs. There's bachelor's-based, and then the community college-based programs. And the community college allowed me to have the flexibility to still be able to work while in school. So I was able to provide for my family and pursue my education. And then with nursing, like I said, you can finish your bachelor's online because you learn all the nursing stuff during nursing school. And the rest is like leadership and, different aspects of healthcare to help you progress the nursing profession. So no, I definitely recommend it. There's not, like I said, there's nothing wrong with it. Whatever you can do to reach that end goal, it's all the same.
Love, love, love that. Thank you. Thank you for allowing me to kind of deviate. So we'll jump into the questions that I actually wanted to ask, but the conversation, when it gets good, my brain starts going. So just bear with me. So what were some of the hobbies that you engaged in as a child that contributed to you becoming and working towards becoming a doctor of nurse anesthesia practice?
I would say music. I mentioned that before. I went to school for music. Music for me was an outlet, but also music is a very it's interesting. It's very concrete and very abstract at the same time, right? So there's a lot of foundational things with music where you have to be okay with delayed gratification until you get better, until you get to the point where you sound good, right? But then there's also a lot of expression in music where you can have all this freedom, especially in like jazz. I love jazz. So with anesthesia, when I look back and people are like, how are they connected? It's the same thing. In the field of medicine, there's a ton of structure. We learn all these things, all this super deep science. But when we're in the operating room, when we're taking care of a patient, there's a million different ways of doing anesthesia. They like to call us mixologists, right? You can, someone having pain, there's, 5, 6 different medications you can throw at them to make their pain feel better, depending on what they need, how their body responds to it. So again, you have this concrete thing from like music, all the structure, and then you have, your expression, that abstract part where you're able to kind of tailor it to the patient and what they need, just like you would tailor the music to the audience and what they would want to find. So I think music, they always say music and science go hand in hand, right? Music and science, music and math. So I think having a foundation in music helps a lot of avenues of our life in general.
That's good. So I have another. This is a sidebar question. Based on- so
Ask away.
how does it feel? Because you literally have people's hands, people's lives in your hands when you are mixing these medications and things like that. What is that feeling? Like, how do you process that and make sure that you are your best self when you show up to administer these medications?
Yeah. Um, I've always felt like I was a person who handled stress well. So working in the emergency department and in the ICU. So maybe that performance, pulling back to music again, maybe that performance lifestyle in the past kind of helped me. So in the moment, I just focus on the patient. Everything else falls away. I remember, so part of our job as CRNAs, we perform every aspect of anesthesia, right? Everything from epidurals to nerve blocks to pain management. We do a lot of different things. And one thing that people think a lot about is when you go under anesthesia and we have to put the tube down, right, to help breathe for you. And that's not in every single case, but in a lot of cases we do. So I remember the first time I went to do that, I remember all my classmates talking to me about how they were worried about all the people in the operating watching them, because until we get that tube in, no one else can do the job, right? It's like it's all on you. And then that's also a very, serious time for the patient, because, you're putting sometimes a metal blade in the mouth to open it up so you can put that tube down so you can breathe for them. And for me, in those moments, those critical moments when I'm taking care of the patient, it's just me and the patient. Like I said, everything falls away. And I seriously just think about what can I do to be my best self for this patient. We go through all this education, we learn all these things to be able to piece together to in that moment when the blood pressure drops or the surgeon maybe cuts the wrong thing and something starts bleeding, how can we act to take care of this patient? So it's serious. It is something that you have to think about. And when people look into this career, they have to like self-reflect to say, can I handle that stress? And you're going to have days where you have super healthy patients, super easy cases, something where, you know, harm to the patient is less than 0.001%. But even in those moments, you still have to stay vigilant and just remember that you do have someone's life in your hands, and that's a blessing. For one, be able to walk into the pre-op area and ease those fears and that anxiety of that patient and say, I got you. I'm going to make sure from the beginning when we walk into the operating room until you wake up and pack you and I say, hey, your surgery's over, it went okay. I want to be able to kind of be that safeguard for that person's life. So, yeah.
That's so good. So, another question for a student who may be looking at this and thinking, I think I want to, go down this career path. What are some things they might need to learn about handling stress or stressful moments or regulation? What are some things that you would suggest? And if you don't have an answer right now, I can come back to it. We can move to another question.
I mean, this is why I think that extracurricular activities are good for kids. Sports, things like that, because you really have to like the stress from all avenues. You're working as a team. It's not just you in the operating room doing anesthesia. You have to worry about what the surgeon's doing. There's a circulating nurse who's, kind of the overseer of the OR, making sure that everyone's doing the job and taking care of the patient. There's a surgical tech who's handing all the instruments to the surgeon, sometimes helping, open things up and, do other things throughout the procedure. And you have to be able to handle the stress of knowing your role within the team, right? The stress of being able to take care of the patient, and I think that starts back in school when we're doing group projects and we're like I said, we're playing on sports teams and doing all that stuff. Um, Stress is it's an everyday thing, and you have to realize that in the beginning you're not going to be good at something. You may have more fear, more anxiety, but the more you do it, the more comfortable you get. There's a surgeon out there somewhere who's been doing this for 50 years, and appendectomy, removing the appendix he's done hundreds of times, but that first time I'm sure his hands were shaking. So you just have to, it's that delayed gratification of knowing that one day I won't be afraid, and you have to push through that until you get there.
Wow, this is so good. Thank you. So we'll jump into the questions now, and
Mhm.
hopefully no more sidebars. But you're doing great. So, also, we talked about hobbies. So, what
Mhm.
skills do you think are important for parents to look for and identify in their children if their child seems to, or wants to go in this direction of nurse anesthesia practice?
Yeah. Um, I would say kids have, so this is not a super fast journey, right? It's shorter than some, but longer than most. So you have to be able to lean into that delayed gratification a little bit. So my son, like I said, he's about to turn 11, and we've been talking about him, potentially playing an instrument or whatever. But I'm like, you have to stick to it. You have to be able to like really, you know, we've been talking about this for a while. Your kid, and I knew that early on he wouldn't be able to do it. Now I'm like, I think he can do it, but this isn't something that you can just, start, stop. You have to be able to have that stick to itiveness, to keep going through. Um, Another skill that people don't think about, um, when it comes to kids is actually video games. And anesthesia, yeah, and anesthesia with technological advances, ultrasound is becoming a big factor that we're using for nerve blocks, even for like epidural placements, for different like assessments. And there's a lot of hand-eye coordination that goes into anesthesia when it comes to placing lines, even like IVs, doing the intubation, doing the nerve blocks, all those things. So I honestly, I wish sometimes that I played more video games because I think my hand-eye coordination is pretty good from maybe the instruments I've played. But I've seen some people be able to pick up an ultrasound and identify landmarks and do things kind of so quick. So those are just a couple things.
Okay, so we can't totally rule out video games.
Nope. No, make sure that it's the appropriate type of video game still though.
No GTA. No Roblox, no GTA. Okay. So what communication skills are required to effectively, function as I'm gonna say DNAP moving forward. But I can also say SRNA, whatever you prefer. Well, I'm gonna say DNAP because you're a doctor. I told you I'll speak that. So what communication skills?
um, Empathy. And emotional intelligence is the big one. So actually, when we apply to anesthesia school, there's the grades, there's the resume, the experience. They like to see leadership experience. A lot of people are going to conferences and do all these things. But at the end of the day, so once you submit all that, and then they say, hey, we like you based off of what we've seen, they invite you in for an interview. And that interview can be a mix of clinical questions, like tell me about the pathophysiology of sepsis, or tell me about all these drugs. But a lot of schools are actually switching to more emotional intelligence based questions because anyone can be smart. You can teach pretty much anyone anything, right? But you can't teach someone how to interact with people, and that's big. I feel like we've all seen medical providers sometimes be a little curt, in certain situations, or they're all about the medicine. And that's why I think a lot of people like interacting with, CRNAs, because we were all nurses first. So we had to, most of us went through a lot of life. And then we, as we're doing our critical care training before we went back to school to get our doctorate. And I feel like that those interactions that we have with that patients at bedside make us more empathetic to their care. We've seen people at their worst when they're super sick on the ventilator and help them get better. So when we go and we see a person and a patient before surgery, we know that this is a scary time for them, right? So you have to be able to make a quick connection with these patients before surgery, right? They're putting their trust in your hands. We're giving you medication that kind of shuts you down, and we take full control from beginning to end. So emotional intelligence, really being able to have conversations. You don't have to be the most extroverted person in the world, but you have to be able to connect to people in a way that they trust you with their care.
I love how you identify empathy and EQ as communication skills. I love that. That's very different. But I mean, you can see the pairing of both of them to communication and having bedside manner and being able to communicate to the patient through your actions and your demeanor and your questioning, your line of questioning, that they're safe with you. So thank you. That's really, really good. So character traits. What character traits, and if you feel like you already answered that, we can skip it. I think the last question, your answer kind of covers both, but if you have any more you'd like to ask
I
or
would say just
share.
one more thing I would add would be confidence.
Okay.
Like I said, you don't have to be the most extroverted person. You don't have to be the most confident person. But when I walk into the room, especially as a student, registered nurse anesthetist, I'm not certified yet. We'll be in a year. But there's always someone who can say, no, I don't want the student, right? So when I walk into the room, even if it's the first time I've ever done anesthesia for that specific surgery, I just try to exude confidence. I try to, I walk in the room with a smile, and first thing I say is, "Hey, you ready to get this over with?" Usually they chuckle or they do something a little bit. I ask them if they have any questions. I answer those questions to the best of my ability, as confidently as possible. Um, and like I said, they need that because, like I said, you're taking care of them. You're taking over their loved one's life, their life. Um, and so, like I said, there's empathy, that emotional connection and intelligence, and just being able to show that confidence that you are going to be able to do it and get the job done.
And that confidence conveys to them that they're in safe hands. If you scared and I'm already scared, like this is not a good combination. Every time you go to so I know for
Exactly.
me, it don't take much for me. Like, why are you shaking?
Yeah, exactly. I get someone else to do it.
Yeah. Yeah, get somebody else to do it. So yes, so you definitely need the confidence. Show up like you belong in that space, like you
Right.
have done the work to be in that space, like you are an expert. Show up. I love that.
Absolutely.
So what were your favorite subjects in school? I don't know if music was one of them. And do you think that those favorite subjects were an indicator of where you are now in life? And I wanted to ask, what instrument or what direction of music did you go?
Yeah. So I went to a performing arts high school, which was very different than most high schools. So we actually half the front half of our day was academics, and then the whole second half of our day was arts. And we had different classes, music history, jazz band, orchestra, wind ensemble. I play trumpet, guitar, and piano. Primarily, trumpet was my main instrument. And so jazz band, I'll say for the music side, was my favorite because I love the expression. I love jazz. Just you can bring classical and R&B and all that stuff into jazz. It's just a blend of expression and artistry. And then like an actual academic class, um, I would say that I loved math and Spanish. Spanish is kind of random, but it's always been a goal of mine to be fluent in Spanish, which I am not yet. I'm going to work on that after I graduate. And now working in the medical field, where we're taking care of so many people from different ethnicities, I think it's amazing to be able to communicate with patients in their own language, and to make them feel comfortable. So that's Spanish and American Sign Language. Those are like my two goals, in life. But then math, like I said, it was concrete. It always made sense to me. I was always good at math, and now I do math every day in the operating room. When it comes to medication, if I have to dilute, medication to increase your blood pressure down, I have to figure out how many, mLs of fluid and how much of this medication, and then what's the concentration of this, if I'm putting something on a pump to run to put you to sleep, so it really is, and maybe not calculus, it is in everyday things that we do in medicine. So those were my favorite subjects.
Love it. So you don't do sine, cosine, and tangent and all of that.
No, I'm good.
Okay, that's really good. I really, you said trumpet, guitar, and what was the other one?
Piano,
Cello?
piano, piano.
Oh, piano, penny. Okay. All right. And then I love that you talked about learning that extra language. I think that adds another layer of security for people of different backgrounds,
Mhm.
that you come in. I've seen it happen with me. So one of my things as far as language is one of my intelligences. Anybody who wants to know, there's something called Gardner's multiple intelligences. And so you have these different ways that you basically access the world. For me, one of them is language, written language, spoken language, but I understand in language also, right? And so for me, one thing I've tried to do in traveling and working in special education with different families is learn at least a greeting in a different language. So I think I'm up to like 8 languages or so. And most
Mhm.
recently, just greetings though, not fluency, just greetings. There's a difference, guys. But I most recently, since January, I have been taking lessons in Swahili, and I went to
Okay.
school and I took Spanish for several years in high school. But I found that learning Swahili pulls out the Spanish that I thought I lost because I haven't spoken it since I moved back home. I haven't spoken it like when I lived down in Tampa. So
Mhm.
definitely the cultural intelligence that is required to be in certain professions, consider that. And cultural intelligence is just being able to interact with different um, people from different backgrounds, but in a meaningful way. Like you don't ever want to, come and you're projecting everything that you know onto them. Like find a middle ground, a common ground to interact with people. So I love that, that's one of your goals. To be able to communicate. And Spanish is it's almost like a second language here in the United States. Like if you don't know some level of Spanish, you're not gonna make it. So consider that in your growth as a human and your little person's growth as a human. Consider language development, right? So, what are the educational requirements? You've kind of shared just a little bit of your journey, but tell us about the educational requirements and those acronyms behind your name. And he's got a lot of them, y'all. He's got way more than I got. I love it.
Yeah. I also want to, throughout this, I'll kind of explain the difference between a physician anesthesiologist and a nurse anesthetist or nurse anesthesiologist. Um, so the traditional path to become again, certified registered nurse anesthetist, a CRNA, is you have to have a bachelor's of science, usually in nursing. You have to be a registered nurse. So again, kind of going through the letters here: bachelor's of science of nursing, and then we have registered nurse. Um, you work in the ICU minimum 1 to 2 years in a critical care setting. So that could be medical ICU, cardiothoracic, but it has to be typically ICU. Some schools allow like level one emergency department. Level one is just the highest level of acuity. So think about all your traumas and everything that come down. Typically, you have to have your CCRN, which is your critical care registered nurse certification. Um, and then like I said, once you have all of that, they want to see leadership experience. Volunteering is good. A lot of people, like I said, are going to conferences. You apply to a program to be a either DNP, which stands for Doctor of Nursing Practice, or a DNAP, Doctor of Nurse Anesthesia Practice. Gets you to the same route. It basically just depends. Those letters basically vary based off of how the program is set up. And then currently, all of the CRNA programs are now at least 36 months. They're all 3-year doctoral programs. In the past, there were master's programs that were a little over 2 years and doctorate programs. But as we are increasing the kind of the breadth of the profession and trying to advance things, again, they've made it a requirement that all programs are a minimum of 36-month, 3-year doctoral programs. And then again, a lot of people want to know the difference between a CRNA and a physician anesthesiologist. So to become a physician, you would do 4 years of undergrad. It can be in pretty much anything from English to biology and chemistry. Then you have to take prereqs for the programs. Usually it's like bio 1, bio 2, chemistry 1, chemistry 2, organic chemistry, biochemistry. And some CRNA schools require some of those classes as well. And then you take the MCAT, which is the medical school admissions test, and then apply to med school. Med school is the additional 4 years, and then anesthesia residency is an additional 4 years after that. So for the med school route, you're looking at a minimum of 12 years usually to go from undergrad to becoming a medical doctor or a doctor of osteopathic medicine, so MD or DO, anesthesiologist. And then the nursing path, again, is that 4 years for your bachelor's, 1 to 2 years minimum of critical care experience, but most people have 3 to 5 on average. And then another 3 years of anesthesia school. So you're looking at somewhere between, what's that, like, 8 to 9 years, of pursuing the nursing path. In the end, We all perform anesthesia. CRNAs are the primary anesthesia provider in rural communities because a lot of physicians, there's a lot of anesthesia residency positions around the country, but there's not enough physician anesthesiologists to fill all the roles. So CRNAs were kind of primarily um, responsible for filling those gaps and needs for anesthesia. We do the same thing inside the operating room. Like I said, we take care of you, we put you to sleep, we do epidurals, we do nerve blocks, the same exact thing in the operating room. We just have different paths to get there. And then depending on the setting, a lot of CRNAs and physicians work in something called a care team model, which means that you may have one physician anesthesiologist who kind of like supervises up to 4 rooms of CRNAs. So they're there for the beginning of the surgery while we're getting the patient off to sleep, and then they're available if we need anything. But then there's also more than half of the states in the US where CRNAs practice completely independently with no physician oversight, like I said, especially in those rural areas. So, like I said, that's kind of the breakdown of both the medical path, as we call it, and the nursing path to anesthesia. They both get us to the same place to be able to provide great care for our patients. We work well together, and anesthesia in general is just a great field.
So lots of learning. If you don't have a desire to dig deep in your learning, then maybe this is not the field for you to consider, or maybe it's not the field for you to consider right after you graduate high school.
Yeah.
So just keep that in mind. Do you think there's anything that students could do maybe in their high school years to prepare them? I know here in Florida, there's some, I want to say, opportunities for students to go through, we call them skill centers. So
Mhm.
they become maybe like a CNA, they get CNA certification in high school, and that kind of helps to transition them into the medical field straight out of high school. So they learn those basics, they get certifications then, and then they move into, maybe a community college setting where they get those prerequisites, and then they move into along the path that you kind of described. Do you think those are helpful? What would you
Absolutely. I mean,
suggest?
I feel like there's so many programs around the country, like you said, whether it's through your high school or elsewhere. But any exposure that you can get to medicine, I think helps because it all ties into, like we said, that empathy and that emotional intelligence that you want to eventually have. You know, I think the more levels of medicine that you can see wherever you end up, it makes you a better provider. So, my nephew, for example, he did a program through his high school where he got certified as an EMT, through school, so he was able to like do some ride alongs and see some things, learn and get, BLS and CPR certified, which I think everyone should do. That's a good skill, even if you're not in the medical profession, because you never know what's going to happen on an airplane or to one of your kids or whatever. So that's a good thing. And shadowing, whether shadowing just nurses, if it's shadowing a physician anesthesiologist, shadowing a nurse anesthetist, whatever you do, just so you can have that exposure, because you don't know until you know, right? I didn't know, even throughout nursing school, people talked about what a CRNA was, but I don't know, it sounded, like this unachievable unicorn of a career. So it wasn't until I became an ICU nurse and I started seeing anesthesia drop off some of the post-operative hearts that we had. And it's like, oh, that was a CRNA? I thought that was a physician. I thought that was this and this, and it's like, oh, let me learn more about that. And then I shadowed, as an adult, as a nurse, shadowed in the operating room. You can do that even earlier. It doesn't have to be after you get through nursing school. And I saw, okay, well, this is the job. This is cool. This is what I want to do. But until you have those experiences and that exposure, you don't know what you're missing. You don't know if you like it. A lot of people want to apply to become a CRNA, especially because rates and stuff have gone up as far as anesthesia pay. But I always tell people, don't go into a field for the pay, because you know you have to be able to go in every day and be able to take care of these patients, in the scariest day of their life. And you don't want to do it because it's for a paycheck. You want to do it because this is a field that you love. This is what you like. Because like you said, it's a lot of training. So you don't want to go through all this training and then at the end of the road say, I don't really like this, you know? So, yeah.
So you kind of hit on something that is a hallmark for our organization. Again, we focus on primary age children ages 3 to 9, but because they go back into families, we have programming for their big sisters, big brothers, their grandparents, their parents, caregivers, all of that. But one of the hallmarks is pre-exposure and early exposure. So you sound like you are a proponent of having those opportunities to see before you know, buy basically, right? So kind of talk, if you don't mind, just kind of dig into that a little bit more, or maybe encourage our parents on making sure that they expose their children, whether it's through a program like our Future Forward program or something in their school. If the kid is showing, proclivities towards this, get them involved, make sure that they're a part, make sure that they're going and seeing what these college campuses that offer a major that they think they want to participate in, make sure that they're a part of things like that. So could you kind of share or
Oh, that,
piggyback or whatever?
no, I definitely agree. Like you said, it's just important because, like you said, you don't know what you don't know. So I think it's highly important for you to get as much exposure as possible. I had a friend who I worked with as a secretary of the emergency department um, who really thought he was going to go to nursing school. And then after 6 months of just being a secretary and seeing the work that people did, he was like, no, I don't want to do that at all. And as kids, we have so many interests. My son, he was really into planes a few years ago, and it's something he's less into planes, but something I still want to do for him is, there's programs where for like preteens and young teens where they can fly planes, where they can get exposure and they can do whatever. So whether it's a plane, it's a train, or it's a car, I want to get him in that setting so he can really explore. If there's a video game camp, that they can go to and they're really into video games and designing, like you said, foster that interest. Um, because you may not even like what they're into. Um, but when they get that exposure, they may realize they don't like it either, right? But they also know that they feel supported, right? They know that, whatever I decide to do in life, my parents going to have my back, and that's going to make them braver and more willing to take the leap, where they wouldn't have. People talk about CRNAs. There's almost 70,000 CRNAs in the country providing anesthesia. Less than 4% of those are African American. When you look at nursing as a whole, obviously it's a female dominated field. And when you get to like these advanced specialties like nurse practitioner and CRNA, that almost evens out, but there's still probably less than 2% that are Black males that are CRNAs, right? So they have to have that exposure because, again, I didn't know what anesthesia was, so it wasn't even on my radar. But I've met so many people who are like, oh, I had a friend whose parent was a CRNA, and I shadowed them when I was in high school. So I knew as soon as I graduated from high school, I went to nursing school, and I knew I was going to be a CRNA. And I got into CRNA school at 23, and I'm like, wow, I got into CRNA school. I started at 31. I'll be 33 when I graduate, which is still fine. But again, if I had that earlier exposure, maybe I would have been here sooner.
So good. So good. Thank you for that sidebar and that admonishment. So let's talk about mentors and the power of mentors. And I would like for you to share, I'll give you three, but definitely two, two people who have served as mentors either in your early life, through high school, or in your adult life as you've been pursuing your current profession.
Yeah. Um, Probably the biggest mentor I've had recently in the recent years as I've been pursuing anesthesia is a woman by the name of Dr. Lena Gold. She's the CEO and founder of an organization called Diversity CRNA. So the kind of the purpose of this organization is to help those statistics that I mentioned not too long ago. Less than 4% of CRNAs being Black, less than 4% being Hispanic. We as patients, need to be able to see people who look like us in those fields. Not even if we don't, we're not pursuing it as a career or profession, but just knowing that we're safe. Sometimes it's nice to see people who look like us. So her organization is aimed at helping critical care nurses, nursing students, kind of bridge those gaps of how can I get into CRNA school. So she brings in CRNAs and SRNAs like myself for conferences multiple times a year. And they hold workshops where you get to practice some of the skills that we do, like intubations, using ultrasound, fiber optic scopes, and all this stuff. They have multiple universities come with their program directors to talk about requirements for the programs. They do mock interview sessions, they do resume reviews, things like that. So this woman, again, she started this, 20 years ago or so, as a poster project, that she just kind of thought about. And it spread into kind of this nationwide thing where, like, we had an event in Baltimore a couple weeks ago, and there was 300 people on the wait list. The event sold out within hours. So like she's made all this change, and all these people of color coming together and saying, I can do this. I'm seeing all these students and all these CRNAs, in these positions, and like they're showing that I'm a normal person, and you can do this too. So when I was thinking about going to anesthesia school, I actually missed the registration for the event I wanted to go to, which was at the University of Pittsburgh in 2023. And I reached out to her first saying, hey, I'm looking for a mentor in my area, because I'm looking into going to school for anesthesia. And the thing she said was, I'll be your mentor immediately. Like I never messaged her before, no hesitation. And then I missed the registration for that event. And this was before, it was popular, but now 300 people being on the wait list, I don't think she would have been able to let me come to the event after it was already full. But she let me come to that event in May of 2023, and that event is what sparked my passion to say I'm gonna do this. I have doubts, I dropped out of school and my grades weren't great the first time, and then I went to nursing school and they got so much better, and like I feel like I can be a good applicant. But I needed guidance. I needed someone to push me. And she was one of those people, and to this day, she still checks in on me. She checks in on my kids. She invites me to speak at these events for other applicants who are coming through. And, I look up to her because I want to continue to spread the knowledge of the career and help increase diversity. I know you said two more, so I won't be as long about the other two. Another mentor who I haven't even talked to in a while, so I'm gonna have to give him a call. But before I pursued medicine and took that first job as a secretary in the emergency department, like I said, I worked at a bank in a call center, and there's a guy who is a manager, and he actually wanted me to promote to a position under him as like his assistant. But I was thinking about going to school for nursing. And I think his mom or his aunt or something like that was a nurse. And he was like, he really wanted me to take this position. But as soon as I talked to him about going back to school and education, he said, then do it. Don't look back. Focus on what you want to do. He said, you can talk to my aunt. She's a nurse practitioner and the head of all these things. She's been nurse, blah, blah, blah. And he just gave me that little extra push that I needed at that moment when I had doubt about, can I take this step back, from making this much money at the bank to, doing this and then going back to school. And yeah, and I appreciate him again, probably more than he knows about that little push. And then the third person that I would mention was my biology teacher at the community college. She, I still try to keep in contact with her, but this woman, she had like 2 master's degrees in biology, and was teaching our intro to bio class. This was the first class that I took before I had to when I was starting to take my prereqs for nursing. I was like, okay, I've been out of school for a couple years. I just want to take one class and prove that I can be a good student, because I was not a good student the first time. So I took this biology class and I gave it my all, and I was going through a lot of life at the time. And this woman, again, 2 master's degrees in biology, she was actually in a second degree bachelor's of science of nursing program. She was trying to become an RN because she always had this dream of becoming a nurse. So she would be teaching her class, and if we had any breaks, sometimes she would pull out her stuff and be reviewing, or sometimes she would be explaining biology concepts and would tie it into things she was seeing in nursing clinicals. So she was working, somewhere between part and full time. She had two kids that sometimes she would bring in the class and sit them in the corner on their iPads. And, she just kind of made me realize, like, okay, she's doing this. She's working while she's in school. She's going back later in life, to pursue this career. And we had many conversations after class, about my doubts, about whether I could do this. And her class was difficult. It was. I ended with like a 96% or something like that in the class, and half the class dropped out. And I think it was partially because I connected to her teaching style. I connected to her as a person, and like part of me, I think, didn't want to let her down too, because like we're talking about this, and she would give me this advice after class. Um, and yeah, I mean, I didn't, and then I kept going. And she works at a children's hospital now, and every once in a while, when I reach a new step on my journey, I'll message her like, "Hey, I finished my bachelor's. Hey, I'm working in this department now. Hey, I got an anesthesia school." So, those three people I feel like have been super impactful on my journey.
I love that. And you brought up a really good point, which is the power of learning how to advocate for yourself. You reached out to Dr. Lena, I think you
Mm-hmm.
said Dr. Lena, and you told her, "Hey, I need help with XYZ." And she said, "I'm your help." Right. And I
She
think a
did.
lot of times closed mouths don't get fed. If you don't learn, especially that's a skill I push for children. When I was in a classroom, I made my children tell me, "What do you need? Tell me what you need. Ask me in the right way. What else do you need? Now, how are we going to go about getting it?" Right.
Absolutely.
But I think advocacy is such a great skill to have because it shows people that you really want what you say you want. So just, I guess, to encourage parents, like, make your children learn how to self advocate with you so that when they go in the community, when they have opportunities or opportunities are available that they want, they know how to approach those opportunities the right way. They know how to, connect with FaceTime. My dad calls it FaceTime. Dad, if you're watching, I never forgot FaceTime, but he calls FaceTime. FaceTime is where you are staring in people's face and let them know, like, I'm present. I really want this, right? And I think that's something that we are losing in this tech age and all of that, after post COVID time where we didn't have those connections. Everything was through a screen basically, and so our kids, I feel like there's a disservice that we've done them. Like, they don't know how to show up and be present and be engaged with people, ask questions and things like that. So I just want to, I guess, encourage parents, like, get your kids to the point of self advocacy. Get your kids to the point of asking questions, of being engaged, of even sharing their dissents if they can do it in a respectful way. There's nothing wrong with saying, like, I don't like XYZ. You just have to do it in a respectful way. But get them in the habit of that, because those are where different opportunities come alive. So you might see the basic opportunities, but you don't know what else that person is connected to. That is long they just looking for the right person to ask, this basic question, and then they say, "You know what? I think you say you're interested in that, but you seem like a better fit for this." You don't know. So,
Exactly, because you like you said, closed mouths don't get fed. You never know
mhm.
what person you talk to is going to lead you to your end result where you're supposed to be. I met people through these events I was talking about through diversity CRNA, who introduced me to someone else, who introduced me to a student at my current school, who we talked and made connections and gave me feedback, and then that girl ended up kind of talking me up to the program director, without even meeting me in person for one, that time. Or at the recent event, I was talking to one of the girls who was applying, and she was saying, "Oh, I really want to go up to this program director, but there's all these people, and I don't want to be rude, kind of like jumping in there." And I had to tell her, "This is your experience, right? It is so nice that you're worried about those other people, and obviously you can do it in a way that's respectful, but you have to advocate for yourself here. You really have, like, I was like, you have to make a goal. There's 4 program directors here, by the end of today, you need to speak to all four of them. At least it doesn't have to be an extensive conversation, but they need to see your face, hear your voice, and know what you want just a little bit. And that's not going to happen by you standing in the corner, right? So yeah, you have to be willing to come outside of yourself a little bit and speak up.
So good. I remember one of my most favorite professors in undergrad, Dr. Festus Ubosha Ohebalam from Nigeria. He passed away, I want to say maybe 2022 or so, but my very first year, I just decided to go and make contact with all the people who were on my first semester of classes. So all the professors that were on my first semester. And I just went and just stopped by, knocked, hey, my name is Nicole Anthony, and I'm going to be one of your students. And I'm an INR major, really excited, da da da. And literally, I want to say three of maybe the five that I had, all professors, doctors from Africa. My undergrad was in international studies, and I wanted to focus on Africa anyhow. So I had all these professors, and literally all of them, including Dr. Ohebalam, took me under their wing to the point that I was almost 3 hours away from home, but I never not had a father figure in my life. Like even on campus, I knew there was accountability on campus, right? So I couldn't go around acting like my parents didn't raise me right. I couldn't go around, just cutting up and all of that because I had a different set of eyes on me. I had accountability hanging in the wings, right? And I remember my very first semester, Dr. Havelam told me, he was like, you're so intelligent, you're so smart. He said, you're going to be a doctor. And I never had doctor on my radar. I just wanted to, back then, this is like almost close to 30 years ago, uh, you know, a bachelor would have sufficed basically, right? And so I didn't have doctor on my radar, but because he said it, because he saw something in me that I did not see at the time. I remember when I graduated in 2023, one of my hopes was that I would get to go back and see him and tell him, I became the doctor that you told me I was going to be. So I just want to, I guess, encourage and along the same lines of what you did, like find those people who can be mentors. I heard someone say recently, there's a difference between a mentor and an advisor. So even an advisor, find someone who can advise you in your profession and the work that you're doing. And then as you make those milestones, like Dr. Smith loading said, as you make those milestones, go back and let them know, like, this is what I'm doing. And based on like the support that you gave me, thank you for that. Those thank yous mean so much to people who pour. It means so much to hear thank you with action behind it. Like the thank you is not just thank you for your time. The thank you is let me show you what happened because you invested in me. So make those connections, push your children, parents to be face forward with people that are doing what they think they want to do later. Push them, push them, push them, push them. So we have come close to the end. I want to ask you a final question and then we'll wrap up. What insights have you gained about yourself um, as you have gone through this journey of becoming a doctor of nurse anesthesia practice?
Um, I've learned that to do pretty much anything in life, you have to be resilient, right? You have to, life is going to come at you in so many different ways. There's going to be loss, there's going to be barriers, there's going to be people who tell you you can't do things. I applied to multiple programs. There's programs I didn't get into, there's programs that I did get into. And in the end, whatever you dream of, you can accomplish if you are willing to put in the work. If you're willing to be resilient. I am a believer in God, and I like to pray, and I believe that whatever is for you and is meant for you is for you, and that you will obtain. Um, and yeah, I don't think that there's anything that we can accomplish, like I said, if we're not willing to put in the work and just keep pushing forward. And like I said before, it's just about taking those small daily steps. You don't have to, people message me all the time, like, in an LPN program, how can I be a CRNA? And it's like, Focus on what's in front of you. Be the best student you can right now. Absorb everything you can right now and take the steps, because you can't leap forward in time, but you can be the best version of yourself every single day, which is going to help you be the best version of yourself when you get to the end of the rainbow. So,
That's so, so good. I love what you said. Take those daily steps. In my book, one of the chapters is called Everyday Effective. And that's something I'm a believer. And one of the things that I remember God just speaking to me was every day make moves towards like the final goal, basically, or what your final end is. So take tangible steps every single day. Do something in diligence towards this goal every single day, and you'll get to where you desire to be, where I've told you you're going to be. But you have to put in the work every single day. Have the end in mind, but know that the end might not be next week. It might be a few years from now, but you are steadily working towards this end goal. And incremental paces, not anything to overwhelm you because you don't want to overwhelm yourself. Sometimes it's hard to look at long term goals and realize that they are long term because we want them to happen right now, right? So give yourself the grace of time of continuing to work towards the goal and know that it's going to happen, it's going to unfold, but you just got to keep moving diligently. Take no thought of tomorrow. Let today take care of itself, right? Just make sure you're vested in today. So
and
thank you for that.
enjoy the journey, because
Yeah.
like I said, I took so many turns, twists and turns throughout life, but every step of the journey I've learned something, from working at the gas station and being in management, to working at the bank and hopefully learning how to manage money better, we'll see, to said all the steps I took throughout my career, from the secretary to the PCT. Like I said, they all come together with who you are, at the end. So try, it's hard, but try to enjoy the journey and remember to take everything, take little things from all of those steps.
I love it. All things work together.
Right.
All things work together. So that's about it. Thank you so much for sharing with us tonight. I'm excited. I'm excited to see what students, will say about this profession. This is something I had never heard of. So I'm so glad that you were responsive to my inquiry to share with us about this profession. Thank you for that. Um, Final notes, any final words that you want to encourage our parents
Well,
maybe
Dr.
with?
Anthony, first I want to thank you for inviting me to be a part of this as well. I love pouring back into the community. Um, Only final notes is, like I said, just keep supporting your kids' dreams. You know, um, like I said, expose them to everything that they can. Try to find as many opportunities to just show them the world. Show them all the things. It doesn't, you know, what their interest is right now may not be their interest in 20 years. We all know that. So just continue to try to expose them. If you're interested in becoming a doctor of nurse anesthesia practice, a certified registered nurse anesthetist, you can always feel free to message me. I'm on Instagram and TikTok at Becoming Dr. Tre SRNA. That in a little over a year, hopefully it just switched to Dr. Tre CRNA, is the goal. And I'm more than happy to answer questions. And then the last thing I just want to touch on is mentorship. You mentioned it. Um, I don't have any structured mentorship program, especially while I'm in school right now. But whether it's me or it's another SRNA or CRNA you reach out to, people always say, will you be my mentor? They're trying to gain mentors. Um, and like you mentioned, mentorship doesn't have to be the super structured process. There's mentors that you can find throughout the world, whether it's through videos like this. This is us mentoring you directly right now, or if it's someone who does message you and say, "Yes, I'll be your mentor." But just make sure that you are, taking those tangible steps, giving that feedback to them, saying thank you, and it's a give and take, right? You want to make sure that you're keeping them updated and making them aware of your success, because we're proud of that. We're invested in that. We want to make sure that you are doing well, and whatever we can do, we'll help you get there.
So, so good. Thank you. So, I will share your social media handles if that's okay with you. And is it okay if maybe parents or students are interested? Students don't reach out directly. I would say have parents reach out on your behalf, just out of respect and whatnot. Um, But if that's okay, I will share your information. And if you feel like this is something you want to know more about, it's not even that you want to pursue this, but you want to know more about it, then Dr. Trey is open to connecting with you all. All right. So this is Mental Health Awareness Month. I'll just share at the end of the month, we will have Miss Crystal Brown. She'll be sharing with us for a segment on attachment. I think that's what we settled on attachment styles. So feel free, not feel free. I'm encouraging everyone to join us. Attachment is something that I don't think a lot of us understand, but it impacts our relationships so greatly. So we'll be sharing about attachment with Miss Crystal Brown. She was with us last year to share about self care for women. We had our Mental Health Month series going, and I'm working on some other things. So there may be some other topics that we cover during this month, but just be sure to tune in. And yeah, that's about it. In June, I would like to invite our partners. Dr. Trey, if you and your family just happen to be in Jacksonville, you probably won't be, but if you are, feel free to stop by. We will be celebrating our year of impact. I believe it's on the 18th of June. I need everyone to register so that I'll know how to prepare as far as food and all of that. But this is our opportunity to celebrate our students, our student leaders, our parent leaders, our community and supporters, people who just pour into us and help us to be impactful in our mission. So this is our honor celebration. And if y'all are here, you happen to be in Jacksonville, you just, came from Pittsburgh for the weekend, then we want you all to be here. And if not,
Thank you very much for
just
the
and if not, just know that we are grateful for you. We are definitely grateful for all that you've given us. But everyone else, if you're here in Jacksonville, I would love to see your face in the place. The address will be given as soon as you register. All right. So that is that. On that night, on that note, I say good night to everyone. Y'all have a wonderful evening. Thank you for joining us, and we will see you again soon, soon, soon.
Thank you all.